Today I will be discussing the rationale for using omeprazole in preventing gastric ulceration in thoroughbred racehorses in training. Several studies have found that up to 93% of thoroughbred racehorses engaged in intense exercise would develop gastric ulcers. Although the etiology of this presentation is unknown, available evidence suggests a multifactorial cause. One study showed that increased duration of exercise increases intra-abdominal pressure, therefore increasing exposure of the gastric mucosa to gastric acid. While another study that suggested the combination of intense training regimens, stress, and diet of high concentrates and low roughage, often accompanying feed deprivation in stall confinement conditions, induced gastric ulcers. Another risk factor implicated in the formation of gastric ulcers in horses include Helicobacter and the use of NSAIDs. These factors, however, remain speculative, as findings are either insufficient or conflicting. Omeprazole is often referred to as an anti-ulcer agent due to its potency in inhibiting gastric acid secretion. It is a substituted benzimidazole compound and functions as a potent proton pump inhibitor, selectively and irreversibly binding to proton pumps on gastric parietal cells. This inhibits the cell's ability to secrete hydrogen ions into the stomach lumen. Supporting the use of omeprazole to prevent gastric ulceration in thoroughbred racehorses is a review paper that analyzed recommendations for treating gastric ulcers in these racehorses. Proton pump inhibitor treatments, like omeprazole, were shown to be more effective than their H2 antagonist counterparts. In this review, 4 studies highlighted the potential prophylactic use of omeprazole and found that orally administered omeprazole was the most effective treatment and prevention. Several studies also demonstrated the success of using lower prophylactic doses of oral omeprazole in preventing the recurrence of gastric ulcers. For example, one clinical trial assessed the efficacy of GastroGuard, an oral omeprazole paste, in preventing the recurrence of ulcers at 2 dose levels. A significant improvement was shown in gastric ulcer scores with daily full-dose treatments and half-dose treatments. Half-dose treatments were also enough to effectively prevent the recurrence of these ulcers. Furthermore, another study compared daily oral administrations at 3 dosage levels inclusive of a control group. It was demonstrated that in the sham-dosed and the 0.5 mg per kilogram omeprazole-treated horses, only 25% and 30% remained ulcer-free after 28 days. Horses treated with the 1 mg per kilogram omeprazole, however, demonstrated an 80% success in the prevention of the recurrence of gastric ulcers. Verifying this result, another trial compared the efficacy of the 1 mg per kilogram treatment against the sham-dosed group. Results yielded a significant difference between the 2 groups, with only 8% of sham-dosed horses remaining ulcer-free compared to the 78% of the 1 mg per kilogram treated horses. In conclusion, omeprazole given orally is both safe and effective in the treatment and prevention of gastric ulcers in training thoroughbred racehorses. It is important to note, however, that oral administration is slow-acting, and ongoing administration of prophylactic doses is required for successful prevention. Given the abundant evidence supporting the efficacy and safety of the prophylactic use of omeprazole, this use of the drug should be encouraged and included as part of the routine supplementation regime. Although the safety of the use of this drug has been evident in multiple short-term studies, further studies can be done to assess the effects of the long-term use of omeprazole in racehorses.